Welcome to Chapter 6, Anatomy and Physiology. We are going to go over just a broad overview of anatomy and physiology. When we get into the chapters themselves, we'll go over a more in-depth kind of review of anatomy and physiology and pathophysiology as well. So visualizing in topography. It's important to know where things are on the body, like the angle of Louis. That particular spot is basically it's that protrusion that comes out on your sternum, and from that angle of Louis we can go to different areas, and we know that if you go to the left of the excuse me, the angle of Louis, it's going to be, the heart and the lungs, the upper lungs. So knowing various things on the body, like where the sternum is, where the clavicle is, various things like that, we can kind of determine what's underneath there and where things are in the body based on those things. So body systems. The musculoskeletal system has three main functions. It gives the body shape, and it protects the vital organs, and it provides for the body movement. If we didn't have a spine, we'd just be a pile of mush on the floor. It allows us to move, and it gives us a shape. So we obviously know that the ribs, which are bones, protect the vital organs such as the lungs, the heart, part of the liver, the diaphragm, all of those things that are essential for living. The skeleton, it consists of the skull, spine, ribs, sternum, shoulders, upper extremities, lower extremities, and the pelvis. And interacting with the skeletal system to give the body the ability to move and flex and do all of the things that it needs to do are the muscles, the ligaments, and tendons. In the skull, we have bony structures of the head. Its function is to enclose, protect the brain. The cranium is the top, back, and sides of the head, and then the face is the front of the skull. In the skull, you have different bones that are fused together through what are called fissures or sutures. You'll see those words used interchangeably, but on the picture you see is the little squiggly lines. Those are where the bones are fused. So each side has a temporal bone and a sphenoid bone. And then you have your frontal bone, which is the front part of the cranium, the forehead, if you want to call it. And then the top of the head would be the parietal bone, and then the bottom of the back of the head is the occipital bone. In the facial area, we have the mandible, which is your lower jaw, your maxilla, which is fused upper jaw. It's fused to the cranium through those sutures or fissures. You have your nasal bones, which is the structure for the nose, your orbits that surround the eyes, and the zygomatic arches, which are your cheekbones. In your spinal column, you have 33 vertebrae that encase the spinal cord. That spinal cord is what sends all of the signals from the brain to the body and from the body to the brain. That spinal cord is like a major highway interstate type deal, where it all converges into the spinal cord, and it sends all of those things back up to the brain. Your C1 and C2 are what's called the atlas and the axis, and those two bones of the spinal cord are what give you the ability to move your head up and down and side to side. So then your spinal cord is broken up into cervical, thoracic, and lumbar, and then you have your sacrum and coccyx. The cervical is 1 through 7, thoracic is 1 through 12. There are 5 lumbar vertebrae, and then the sacrum and coccyx make up 3 fused vertebrae. Technically, sometimes you'll see those 2 put together as one. In your thorax, which is your chest, you have 12 ribs and sternum connected to the thoracic spine in the back. There are 10 attached to the sternum and 2 that are floating because there is no anterior connection to them. Your sternum is the breastbone, and then you have in your breastbone, the sternum, you have your suprasternal notch, which if you feel right below your neck, right on your neck, I guess, there's a little V at the top of the sternum. That is that suprasternal notch. And then you have your manubrium, which is the big flat piece right there. And then the sternal body starts right there. Your sternal angle is the angle of Louis. Some guy named Louis named it after himself. So basically that's why it's called that. And then down at the bottom you have your xiphoid process. And then in between each rib you have sternal muscles or intercostal muscles that allow for the expansion and retraction of the chest to allow you to breathe. And then it protects the heart, lungs, and major blood vessels, your aorta, and various things like that. Your pelvis. So in the pelvis you have your ilium, which is your hip bone. And then of course the sacrum and coccyx are fused into the pelvis. And then you have your femur, the head of the femur, which is your hip, your acetabellum, which is where the ball of the end of the femur goes into, and then your ischium, your pubis, all of those things make up the pelvis bone. In your lower extremities, you have your femur, which is the big long bone there, and then your patella, which is the kneecap itself, the fibula, which is the outside of bone, it's a smaller bone, then the tibia, which is on the inside, and then you have your tarsals, your metatarsals, and your phalanges. And then your ankle bones are the lateral malleolus, which is the outside ankle bone, and then your medial malleolus is the inside of the ankle bone, and then of course all your tarsals. You've got metatarsals at the top of the foot, tarsals at the middle of the foot, and then your phalanges, which would be your toes. Again, in your foot, you've got your metatarsals, your calcaneus, which is the heel, and then the phalanges, which are the toe bones. In your upper extremities, you have your clavicle, your scapula, your acromion process, which is the acromioclavicular joint, or the ACM joint. So that joint, if you take your thumb and you put it into your shoulder, and you kind of feel around and you pull your shoulder forward, you'll find that joint right there, and that's where your humerus meets your shoulder. Yeah, the scapula is that big triangle thing, the shoulder blade, as it were, in the back. And then of course you've got your humerus, which is the long bone in the arm. Your radius on the outside. When you talk about radius, the easiest way to remember it is that you take a radial pulse And where do you take that radial pulse? It's on the thumb side of the wrist. And when you take that radial pulse, it's right there on the radius is what you're occluding that vein on the radius. And then your ulna, which is the smaller bone on the inside. And then your carpals, metacarpals, and phalanges as well. Okay. In your wrist, you've got your radius and ulna that meet together with the carpals, and then you've got your metacarpals in the middle, and then your phalanges, which are your fingers. Joints. So there's several different types of joints. The biggest ones are the ball and socket and the hinge joint. And these are formed when bones connect to other bones. When we talk about pivot joints, you're talking about like your fingers are pivot joints, or I'm sorry, those are hinge joints. The pivot joint is in the C1 and C2 that allow you to move your head side to side. Your ball and sockets are your shoulders and hips. And then you've also got saddle joints and gliding joints as well. Your gliding joints really are like in your vertebrae, where they've got muscle and tissue in between each vertebrae, and those kind of glide on that together. Okay, so your muscles, you have three different types of muscle. You have skeletal and smooth, and then you have cardiac muscle. Your skeletal muscle is the voluntary muscle that allows you to do whatever you want with that muscle. And then your involuntary or smooth muscle basically doesn't allow you to do anything with it. It does it on its own. Smooth muscle includes your stomach and the colon. Those basically allow peristalsis to work, and that's just basically the moving of food through the digestive system. And then your voluntary muscle allows you to smile, move your arms, move your legs, breathe, those type of things. Your cardiac muscle is a separate muscle, even though it is involuntary or smooth muscle. It generates its own electrical impulses, and we'll talk about those when we get into cardiac. So again, your voluntary muscle or skeletal muscle is under conscious control of the brain via the nervous system. Again, that nervous system comes down from the brain, and it has all of these nerve endings that basically say that fire from one nerve ending to the other that says, hey, I want to move my finger, and it does it very rapidly, very quickly, and sometimes without conscious control. We just do those things like moving your hands when you talk. That it's sometimes unconscious. They are attached to bones, and they form major muscle mass of the body. They can contract under voluntary command of the individual. Involuntary muscle is smooth muscle. It is found in the gastrointestinal system, the lungs, blood vessels, and urinary system, and controls the flow of materials through these structures. It responds automatically to orders from the brain. They cannot be controlled by the individual, and it does not respond, or it does respond to stimuli such as stretching, heat, and cold. I can't make my body stop me from moving things through my GI tract. If I eat, it happens. I can't stop it. That cardiac muscle is that specialized form of involuntary muscle found only in the heart. It's extremely sensitive to decreased oxygen supply, and it has its own supply through the coronary artery system. It has automaticity, or the ability to generate and conduct its own electrical impulses, creating a heartbeat. The respiratory system, so this is when air moves into and out of the body, moves through air through the mouth and the nose into the nasal and pharynx, and then it goes into the larynx, where it gets into the lower respiratory tract, such as the trachea, and then you have your right and left main stem bronchi, and then it goes into your bronchi, and then bronchioles, where it terminates into the alveoli. You also have the epiglottis that covers the glottis, which is the opening of the trachea. Basically, if you're going to breathe, it opens up and it allows air to go into the trachea. If you're going to swallow, it closes over the trachea so that way nothing can get into the trachea. Your larynx is where the voice box is. It has the vocal cords. It also has the cricoid cartilage that forms over the lower portion. You have your trachea, your lungs, your bronchi, and then again those alveoli, where the gas exchange occurs. This gas exchange is in between oxygen and carbon dioxide. We bring in oxygen and we expel carbon dioxide. And then you have your diaphragm as well in the lower respiratory tract. So inhalation is an active process. The diaphragm and intercostal muscles contract. The diaphragm moves downward and the ribs move upward and outward to allow air to come in. This is a negative pressure system and it pulls air into the lungs. Exhalation is a passive process where the diaphragm and the intercostal muscles relax. Positive pressure pushes the air out of the system, and this is a positive pressure system. Ventilation. So ventilation is the movement of gases to and from the alveoli. Respiration is the exchange of gases between cells and the bloodstream. So when we talk about ventilation, there are two different things, and sometimes you'll see these, and I'll refer to them as well, as cellular respiration and just regular respiration. When I talk about regular respiration, I typically talk about bringing air in and moving those gases between the alveoli and the bloodstream. And you see here on the right side of your screen, you have those grape-like sacs, which are called the alveoli. These alveoli fill with oxygen, and then there are capillary beds that surround these alveoli. And what happens is through a process of diffusion, then the O2 gets diffused across the capillary bed into the arteries, or I'm sorry, the arteries, and takes the oxygen to the heart, where it then gets distributed through the body. What happens from the heart is in the veins, the blood comes from the heart to the lungs into the alveoli, and it brings CO2, which is waste from the body, through a process called the Krebs cycle, and energy wasting, various things like that, where it creates this CO2, and that CO2 is brought to the lungs where it is breathed out. Oxygenated blood is carried from the lungs to the heart and then is pumped to the rest of the body. At the cellular level, which is when I refer to it as cellular respiration, oxygen is exchanged within the cells for waste and carbon dioxide. Again, it is through those capillary beds that surround the cells, and through a process of diffusion, it puts in oxygen and it takes out oxygen. Deoxygenated blood returns to the heart, then to the lungs to exchange waste CO2 for O2. Okay, so pulmonary circulation, blood comes into the heart, goes to the lungs. This is deoxygenated blood that goes into the heart. and it goes into the lungs. The deoxygenated blood gets exchanged for O2, and then it comes back to the heart to then be pumped out. The pediatric airway, so we talked about the adult airway. It is pretty much the same thing, except the structures are all the same. However, there are different sizes. For kids, they have narrower nares, which doesn't allow them to breathe in that air as good. They also have a larger tongue that takes up more room in their mouth than an adult does, where our tongue is, 20% of our mouth, theirs is 60%. Those are not the right numbers. I'm just throwing out an example. They also have a high glottis. They have slanting vocal cords and a narrow cricoid ring. So the cricoid ring is what, the cricoid rings are what kind of protect the trachea from collapsing and give it a structure. In the trachea itself, it is a funnel type deal, where it starts out big at the top where the vocal cords are, and then it kind of narrows into a funnel. They also have a larger occiput. This occiput, it doesn't allow them to lay flatter. So if you imagine laying down on your back and your head, you know that your head kind of hyperextends. But when we talk about kids and infants in particular, when they lay down, they have that larger backbone on their head, and it basically pushes their head forward to close off the airway. The cardiovascular system, so this includes the heart, the blood, and the blood vessels. Okay. There are 4 chambers to the heart. There are 2 atria, which are the upper areas, and 2 ventricles, which are the lower areas. The pathway that the blood takes through the heart is from the right atrium to the right ventricle, to the left from the right ventricle to the lungs, and then back from the lungs to the heart to the left atrium to the left ventricle, which is the bigger ventricle. It has more muscle mass around it because it has to pump blood through the body. Okay, so a bigger picture of the way it goes. So we come in from the body to the superior vena cava and the inferior vena cava, which are big highway interstate blood vessels. When it gets to the right atrium, it goes through the tricuspid valve into the right ventricle. From the right ventricle, it then goes into the pulmonary arteries to go into the right and left lungs. From the right and left lungs, it goes into the capillary beds, where it gets exchanged from oxygen to CO2, and then it comes back into the heart through the right and left pulmonary veins. From the right and left pulmonary veins, it goes into the left atrium, to the mitral valve or the bicuspid valve, into the left ventricle. From the left ventricle, it goes into the aortic valve and into the aorta. There at the top, from the aorta, it goes into the left and right carotid arteries, and then your ascending aorta, which is what you see there, and then your descending aorta, which is in the back of the heart, and then it goes to the rest of the body. From the ascending aorta, though, you also have a coronary artery branch that supplies the heart with blood, and it pretty much does that the very first thing because it needs that oxygenated blood. Again, some things to remember is that you have an apex. The apex of the heart is the bottom of the heart where it kind of points off into a point. And then you have your septum, which is what splits the right and left ventricles. We talked about this cardiac conduction system that the heart has, that allows the heart to beat and allows the muscles to then contract to send blood to where it needs to go. At the very top right here is your sinoatrial node. This is the pacemaker of the heart. This is what starts the electrical impulse to send through the heart. From here, it goes into the internodal pathway for the atrium. It also goes over here to the left atrium, so that way they beat together, and you get a lub-dub sound. It then goes into the the AV node, or the atrioventricular node. This AV node sets off the rest of the system, where it goes into the ventricles and allows the ventricles to pump blood itself. It goes into, if you want to go farther, it goes from the AV node to the bundle of His, and then it goes into the bundle branches. You have your right and left bundle branches, and then from there it goes into the Purkinje fibers around the ventricles themselves. When we talk about the SA node, if you ever hear what like atrial fibrillation, so atrial fibrillation is a common problem. You will see most patients, you'll see lots of patients with AFib. And basically what's happening in AFib is this SA node right here is quivering. It basically says, hey, I'm not doing something right. I don't feel good. So I'm just going to quiver. And so what happens is this SA node just kind of sits there and quivers. Well, when it gets down here into the AV node, the AV node says, hey, you're not feeling right, but I do, so I'm going to fix you. So then it fixes the impulse once it gets through here into the internodal pathway. And when it fixes the impulse, it then fixes itself, and the rest of the impulse goes normal. When we have something like a cardiac arrest, where we have ventricular fibrillation, which is a problem where the ventricles are fibrillating and they're just quivering down there because they don't know what to do, because the AV node says, hey, I'm not feeling good now. I'm just going to sit here and just kind of quiver and shake, and that's what it does. The heart cannot sustain that because the heart, because we have to have the ventricles to pump blood to the lungs and to the rest of the body. That left ventricle, if it's not doing its job, it's not getting blood to where it needs to go. The heart is not getting blood to where it needs to go. So coronary perfusion is not what it needs to be. So basically, to fix that particular thing, that ventricular fibrillation, you're going to shock the heart. And we do that through the AED or manual defibrillation with in the hospital or with a medic. Okay, so then we have the arteries. We have coronary arteries, which supply the blood, which supply oxygenated blood to the heart. You have your right mainstem coronary artery. You have your left mainstem coronary artery. And then you have your circumflex artery, your left anterior descending artery, and then you have your right descending artery as well in the back. You also have your pulmonary arteries, your carotid arteries, and your femoral arteries. Those are the big, huge arteries. So if you want to think of it as a highway system, your aorta is the interstate, and then your pulmonary arteries, carotid arteries, femoral arteries are all your highways. Your abdominal aorta is the interstate as well, that brings the major supply of blood to the rest of the body. And then from the aorta, you have your state highways like Highway W that comes off of 54, that type of thing. Highway O, your lettered highways. And then from there you have your arterials, which are your like gravel roads, your driveways, various things like that. I guess if you want to keep going to the state to keep this kind of going, those would be your gravel roads, your smaller paved highways or roads, your city streets. And then from your arterials, you go into your capillary beds. These capillary beds would be your driveways, where the driveway ends at the cell or the terminal end of the artery, where from the driveway it goes into the house, it picks up the CO2 and drops off the groceries of O2, and then it brings out the trash to take to the dump. From the dump, it goes back into the capillaries to the venules, which are your driveway, your out driveway, and then your veins, and then your superior vena cava, and then your inferior vena cava, bring it back to the heart, back to the trash dump, to get pushed out of the body. So your brachial artery, radial artery, posterior tibial artery, dorsalis pedis, these are all arteries where you're going to feel a heartbeat, or you should feel a heartbeat. The dorsalis pedis is a very hard one to feel, but you can feel it, especially on kids. It's a little bit easier.
As the heart pumps, arteries, shown here in red, carry oxygen-rich blood away from the heart toward the body's tissues and vital organs. These include the brain, liver, kidneys, stomach, and muscles, even the heart muscle. At the same time, veins, shown here in blue, carry oxygen-poor blood from the tissues back to the heart. From there, it passes to the lungs to get more oxygen to take back to the heart so the cycle can repeat.
Veins, when we talked about these carry blood from the capillaries back to the heart to the right atrium. Venules are the smallest veins, which we, in our scenario, is the gravel roads. And then those connect to the capillaries, which are our driveways. The superior vena cava then collects the blood from portions of the body below the heart, and the inferior vena cava collects from the, sorry, that's wrong. Your inferior vena cava collects blood from portions of the body below the heart. Your superior vena cava collects portions of, or blood from portions of the body above the heart. Pulmonary veins carry oxygenated blood from lungs to the left atrium then. And then out to the lungs through the capillaries, through the alveoli to do what it needs to do. So blood. Blood itself is composed of plasma, red blood cells, white blood cells, and platelets. Plasma is more than half of the volume of the blood. Your red blood cells include erythrocytes and red corpuscles, or corpuscles. Your white blood cells, which basically say, hey, this is they make up your infection fighting type deal. So when you have elevated white blood cells, those it shows as an infection. And then platelets that help with clotting as well. Pulse is the pressure wave of blood flowing down an artery when the left ventricle contracts. It can be felt by compressing an artery over a bone. Pulses near the center of the body, or near the center part of the body, and include the carotid and femoral pulses that can be felt even when peripheral pulses, which are too weak to be felt. So your central pulses are those pulses like the femoral artery and the carotid artery are central pulses. Your peripheral pulses are your pulses like on the wrist, your brachial artery, the popliteal pulse, the dorsalis pedis pulse, all of those pulses anywhere not centrally located on the body are called peripheral pulses. Okay, again, all these pulse points on the body. Typically, we take a radial pulse. For kids and infants, we're going to do a brachial pulse. And then if we're in cardiac arrest, we're going to do either a carotid pulse or a femoral pulse. Blood pressure. So this is the force of blood that exerts against the walls of the blood vessels. Your systolic, which is that upper reading, is the arterial pressure when the left ventricle contracts and pushes blood out of the body or out of the heart. And then your diastolic, or that lower reading, is the pressure when the left ventricle refills. So when the left ventricle pushes heart or blood out of the heart to the body is your systolic, and when it relaxes and it starts to refill, that's your diastolic pressure. Mean arterial pressure. This is a measurement that explains the average blood pressure in a person's blood vessels during a single cardiac cycle. A single cardiac cycle is one heartbeat. It measures the pressure necessary for adequate perfusion of the organs of the body. Perfusion. So perfusion is adequate supply of oxygen and nutrients to the cells of the body with the removal of waste products. When we talk about hypoperfusion, we talk about shock. This is when perfusion becomes inadequate. The life support chain. So the interaction of the respiratory system and the cardiovascular system is the cardiopulmonary system. Typically when you talk about the cardiopulmonary system, or each one of them separately, you can't talk about one without talking about the other, because they are intertwined. Perfusion is when the cells are oxygenated and carbon dioxide is removed. Oxygen and glucose are required. So aerobic metabolism is when it uses oxygen to help convert the glucose to ATP. Okay, and it does that through a series of events through the Krebs cycle that creates 32 ATP with aerobic metabolism. That ATP is basically energy that the cells use to do what they need to do. We have to have glucose. Glucose is just sugar. So where do we get glucose from? We get it from eating. Okay. And then our anaerobic metabolism is when oxygen is not present, producing less energy and more waste, such as lactic acid. So what happens when we use anaerobic metabolism is that the cells are not getting the oxygen that they need, so they can't produce the 32 ATP. Okay, they produce like 2 to 3 ATP when they are using anaerobic metabolism. So that's a vast difference between 32 with aerobic metabolism and 2 to 3 with anaerobic metabolism. Because the body can't produce that energy, we then have much more waste because the body is still trying to produce the metabolism, but the oxygen isn't there to do that, or the ATP. So the oxygen isn't there to produce that ATP. So we produce all this lactic acid. And if we don't get rid of that lactic acid, presumably because we're not bringing in the oxygen, we're not also getting rid of that lactic acid, we become acidotic. Okay, so then we have this VQ mismatch, or match. This is when ventilation and perfusion match, causing the perfect amount of aerobic metabolism, the perfect amount of bringing in oxygen and expelling carbon dioxide. So it's sufficient blood with sufficient air is the ventilation perfusion match. Anything that threatens this normal function of the cardiopulmonary system is a threat to the quality of perfusion. So if you're breathing too fast, then you're bringing in more oxygen and not getting rid of enough carbon dioxide. Okay, so what does that do to the blood? The blood isn't getting sufficient oxygen. Because of that, the cells will then go into a anaerobic metabolism because they're not getting the oxygen that they need. Or on the flip side of that, we've got too much blood, or let's say we don't have enough blood. We have enough air, but not enough blood. So if we've got enough air and the blood circulating is not enough, what's going to happen? There's not enough blood to carry the air to the cells. The cells, again, are going to go into anaerobic metabolism, and they're going to say, hey, I'm not getting enough air, so I need to do, create less energy because I can't use that much energy because I just don't have it. Okay. So the biggest things to remember in EMS is that blood goes round and round, air goes in and out, and if it doesn't do one of those two things, we have to fix it. Okay. So if blood isn't going round and around, we have to fix it. We fix it through either CPR or we fix it through stopping whatever is bleeding. Okay. If air isn't going in and out, we have to fix that. They either have a bad airway where we have to fix the airway itself, or they're not breathing and we have to breathe for them. So we have to do one of those 4 things to fix the person if air is not going in and out and blood is not going round and round. All right, so that is the major systems of the heart, of the body. We're going to talk about they're not lesser systems, but they're systems that we don't necessarily deal with all the time. Okay, normally we deal with the cardiopulmonary system, and that's our biggest focus. But you guys need to know everything else because it goes into those things. It goes into the cardiopulmonary system to make everything that allows the cardiopulmonary system to work. Okay. The lymphatic system, so its functions are to capture fluid, maintain balance of fluid as well. And then the lymphoid organs are the adenoids, the tonsils, the spleen, the thymus, and the nodes. Okay. This system basically is what helps maintain that fluid balance of plasma and water inside the body and various things like that. The nervous system is the central. We've got the central nervous system in the nervous system, and then you've got your peripheral nervous system. Your central nervous system includes the brain, the spinal cord. This transmits impulses that govern sensation, movement, and thought. It controls the voluntary and involuntary systems, and it also controls consciousness, or the reticular activating system. The peripheral nervous system is your sensory nerves. These pick up information from the body and transmit back to the brain through the spinal cord, and the motor nerves carry messages from the brain to the body. Your autonomic nervous system, it has 2 different systems in there. It divides up into 2. This includes the involuntary motor functions. When we split the autonomic system, we split it into the sympathetic nervous system and the parasympathetic nervous system. Your sympathetic nervous system is a crisis system or a fight or flight response. When you get scared, when you get nervous, anything that stimulates the body, an outside stimulation, will cause the sympathetic nervous system to kick in. And this basically says, hey, you either not need to fight, get ready to fight, or you need to flee. And it basically increases heart rate, increases respiration, so that way it can get the blood flow ready to start fighting. Your parasympathetic nervous system is the opposite of that, and it's the relaxation phase or system. And basically it says that it's the feed or breed system. This feed or breed system says, hey, I'm going to relax. I'm going to start digesting. I'm going to have the need to start breeding and feeding. That's what that system is, and that's normally where our system stays. It does not stay in the fight or flight system all the time. So your digestive system, this provides the mechanisms by which food travels through the body and is digested. The mouth breaks down food with saliva and chewing. It goes into the oropharynx and then to your esophagus, which is the tube that intertwines with the trachea, or sits right behind the trachea, and then it goes into your stomach. The stomach has acidic juices that break down food into the components that will allow the body to convert it to energy. And then your small intestine, which has three parts, your duodenum, your jejunum, and your ileum. This continues to break down that food and absorbs it through the wall of the small intestine. The large intestine then removes water and waste products as they move toward elimination. Accessory organs in the liver or in the digestive system include the liver that produces bile that's excreted into the small intestines to break down fats, detoxifies harmful substances, stores sugar, and assists in production of blood products. The gallbladder serves as a storage system for bile from the liver, and your pancreas regulates sugar into the bloodstream and secretes juices that assist in breaking down proteins such as carbs and fat. Your pancreas it produces insulin that breaks down that sugar and regulates the sugar. So if you take too much sugar, the pancreas produces insulin to break down that sugar into something more manageable, and allows the body to use that sugar as appropriately. Your spleen filters out older blood cells, and then your appendix, they're still trying to figure out what it does, but it's often the cause of abdominal pain. Your integumentary system, which is the skin, provides protection, water balance, temperature regulation, excretion, and shock or impact absorption. You have three different layers. You have your epidermis, that's composed of dead cells that are rubbed off or sloughed off and replaced. There are no blood vessels or nerves in this layer. The dermis, which is that middle layer, is rich with blood vessels and nerves. It has specialized structures such as sweat glands, sebaceous glands, and hair follicles. And once exposed, contamination and infection are major problems. And then your subcutaneous level layer is your shock absorption and insulation. And when injured or exposed, the tissue and blood stream contamination and contaminates the tissue and bloodstream and bleeding, causes bleeding and pain. Your endocrine system produces hormones that regulate many body activities and functions. The pancreas secretes the insulin, which is critical to the body's use of glucose. And your adrenal gland secretes epinephrine and norepinephrine that serve as neurotransmitters and engage the sympathetic nervous system. Your renal system is composed of your urinary system. It helps regulate the body's fluid levels, filter chemicals, and adjust the body pH. Kidneys are principal organs. They filter urea from blood, provide fluid balance, and produce bicarb to regulate that pH as well. Your bladder is a fluid reservoir for urine. Again, your male urinary system. You have your kidneys, your ureters that bring the waste from the kidneys to the bladder where it gets stored. And then when you have the feeling that you need to go to the bathroom, the prostate releases and allows the kidneys to, or the bladder to relax and excretes it out through the urethra. The ureters transport the urine to the body, or to the bladder from the kidneys. The urethra excretes the urine from the bladder to the external environment. The reproductive system. So in the male reproductive system, you have your testes, which produce the sperm housed in the scrotum. Your epididymis is the tube that connects the testes. And then your penis is the sexual intercourse, used in sexual intercourse and urination. Okay. In the female reproductive system, it's a little bit more complex. You have your ovaries, which are bilaterally in the lower quadrants of the female abdomen, and they produce the ova or eggs for reproduction. From your ovaries, you have your fallopian tubes that connects the ovaries to the uterus, and then your uterus, which is a muscular organ that contains the fetus, and then your vagina, which is the exit route for the fetus and as for sexual intercourse. Okay, so up here you have your abdominal cavity, your uterus, which expands as the baby expands, your ovary, your fallopian tube here, your ovary. This is your uterus that expands with the baby. This is the female urinary bladder, which is why moms have to pee so much when they are pregnant, because what is this doing? It's pressing down onto the urinary bladder to make room for the fetus. And then your vagina here. And then females have two holes for your urethra and the vagina. Your urethra is what comes from the bladder to expel waste urine, and then the vagina is what the penis goes into to ejaculate and fertilize the egg.